Hello everyone. Today's topic is microbiology by systems and the causes of pneumonia. First, we will discuss. And the causes of pneumonia, common causes of pneumonia in different types of patients are different, as you know. And so, now I'm going to discuss them number wise. Pneumonia, common cause of pneumonia in immunocompromised patient is pneumocystis cystis gyrovecii, especially with HIV patients, and atypical or walking pneumonia. Most common causes mycoplasma pneumoniae, and mycoplasma pneumoniae is in children and young adults, increased college students, military recruits, and prison inmates. And most common fungal infection in Texas and Gulf coastal region is Histoplasma capsulatum. And other problems with other health problems or alcoholics pneumonia is Klebsiella pneumoniae, and it has current jelly sputum. And bird handlers internal pneumonia is Chlamydia psittaci. Bat and its droppings pneumonia is Histoplasma capsulatum. And recent visit to South California, New Mexico, or West Texas, it's coccidioides immitis. Q fever is Coxiella burnetii. Air conditioner pneumonia is Legionella. And 1 year young, most common pneumonia is RSV. Neonate birth to 28 days, most common pneumonia is E. coli or GBS. And children or young adults are not included in it. And Volz-Sorter disease lifetime life is Bacillus anthracis, and endogenous flora in 20% of the adults is Streptococcus pneumoniae. And common bacterial cause of COPD exacerbations is H. influenza. And in ventilator patients and those with cystic fibrosis, common pneumonia is Pseudomonas. And Pontiac fever is Legionella pneumophilia. Cough, rust colored sputum is gram stained sputum. Green stained sputum is strep pneumoniae. And gram positive cocci, these are diplococci. Gram positive cocci, sorry. And older patients, male patients with blood in urine and renal stones, these are Proteus mirabilis. Osteomyelitis is Staph aureus. And septic arthritis in 20-year male, Neisseria gonorrhea. And about the syphilis, congenital syphilis is early and late. Early is in first 5 weeks, and late if left untreated in the first 3 months. And early syphilis affects liver and spleen, and there are raised LFTs, liver function test, hemolytic anemia, jaundice, rash, discoloration of hands and feet, and snuffles, blood tinged nasal secretions, radiographic changes at birth, metaphyseal dystrophy or periosteitis. And late is if left untreated in the first 3 months, and that is Hutchinson's teeth, saddle nose deformity, frontal bossing, sever shins, anterior bowing of tibia. And if torch infections are toxoplasma, and others are parvo virus B19, rubella, CMV, HIV, HSV, syphilis. And a 50-year and there are abdominal surgery 2 days ago in case and the 50-year of person, and with an internal catheter develops a fever of 100 degree Fahrenheit and UTI, then it's UTI. And clue cells are in Cardinella vaginalis, that is bacterial vaginosis. And painless genital ulcer is Treponema pellitum. And for a primary syphilis. It's a primary syphilis. Strawberry cervix is Trichomonas vaginalis. And the causes of pneumonia are in age wise is like 6 to there are different 4 categories we divide into. There are 6 to 18 years, and then 18 to 40 years, and 14 to 65 years, and then elderly patients. In 6 to 18 years, these are the first is and in all of I'll discuss their causes later on. And age-wise pneumonia causes of pneumonia are 6 to 18 like 6 to 18 years. So the most common causes strep pneumonia, and then chlamydia, and then RSV, mycoplasma. And 18 to 40 years is mycoplasma comes first, strep pneumonia then, and chlamydia pneumonia. And 40 to 65 years is strep pneumonia, hemophilus influenza, anaerobes and viruses. And elderly patients, they have strep pneumonia, viruses, gram negative rods, and anaerobes and mycoplasma. And among the viral among the discussing the findings which will help you distinguish between bacterial meningitis from viral, fungal, or viral meningitis, are that there are some differences of opening pressure, glucose, protein, and neutrophils in all of that. In bacterial and fungal, the most of the and the common things are increased opening pressure, decreased glucose, and increased proteins. But bacterial has increased neutrophils, and CSF has sorry is pneumonia for has and lymphocyte are increased in fungal or TB pneumonia, TB meningitis is the CSF, and yes, is the meningitis we are discussing. And in the viral, it is viral in meningitis, everything is normal. So bacterial has increased neutrophils, and fungal, the difference between bacterial and fungal versus fungal or fungal and TB, fungal or and TB is that bacterial has increased neutrophils, and fungal and TB has increased lymphocytes, but rest of the things are same. And viral, like increased opening pressure, decreased glucose, and increased proteins and opening pressure, and decreased glucose. But the viral is the same, everything is same. So and now we discussed the TB drugs of TB, and drugs of TB, and we will like what is you should know what is the PPD the test, and when it is what does a positive PPD mean. That means that you have a positive current infection or past exposure or BCG vaccination done. And negative PPD means PPD is a test, it means no infection, energic or steroids, malnutrition, sarcoidosis, immunocompromised, because of you can generate immune response. And dapsone is used in leprosy and PCP pneumonia. Side effects of dapsone are G6PD, hemolysis, and methemoglobinemia. And GON complex. What is a GON primary TB complex? So, what is the distinction between a GON complex and a GON focus? And are they seen in primary or secondary TB? So, GON complex is a hilar lymphadenopathy plus a GON focus, and GON focus together. They make a GON complex. But the GON focus is calcified lung scar. And secondary TB is both are seen in primary TB, but secondary TB has fibrous caseating granulomas and cavitations in upper lobes. And mycobacterium species causes which causes leprosy is Mycobacterium leprae, and which causes pulmonary TB like symptoms in COPD patients is Mycobacterium kansasi. And the and the Mycobacterium species which causes cervical lymphadenitis in children is scroflacium. That and MAC, it causes disseminated disease in AIDS patients. And the treatment is azithromycin when the CD4 count is less than 50 as a prophylaxis. And marinum, Mycobacterium marinum, it causes hand infection in aquariums. And the only agent used as solo prophylaxis in TB is isoniazid, and it decreases mycolic acid synthesis, and is a solo prophylaxis in TB. And INH, the drug cocktail used for the treatment of tuberculosis is RIPE, like rifampicin, isoniazid, pyrazinamide, ethambutol. And which iso and what antibiotic is used for the prevention of MAC in AIDS patient, and when should this prophylaxis begin is azithromycin is the treatment, is a prevention, but it should be begin at a CD4 count of less than 50, and MAC patient. uh, Mechanism of action of isoniazid is that it decreases mycolic acid synthesis. Side effects are INH injuries, injures neurons and hepatocytes, and neurotoxicity is reversible if given B6 pyridoxine. And there is hepatotoxicity, drug induced lupus, and there are antihistone antibodies we have to check. And the drug which are known to cause drug induced lupus are hydrolysine, isoniazid, and procainamide. And R's of rifampicin are that RNA, it is an RNA polymerase inhibitor, reverse CYP P450, red or orange body fluids, and rapid resistance if used alone. And for which infections we can use rifampicin is TB, leprosy, prophylaxis for meningococcus or H influenza infection in children. And what is the most important side effect of ethambutol? Is optic neuropathy, red green color blindness that is reversible. And the mother of a patient recently hospitalized for H influenza calls the clinic because she notices blood in her own urine. What is the likely cause of her symptoms? Orange urine from rifampicin prophylaxis. And the patient is attempting to recall for you what medication he's taking, and there is one medication that he is taking to keep his lungs healthy that he also says can hurt his nerves unless he takes his B vitamin. What is the drug? And that is isoniazid. What drugs are famous for inducing P450 cytochrome P450? These are mm, BCG, PQRS, C4, P450. These are barbiturates, carbamazepine, crazofulvin, phenytoin, quinidine, rifampicin, Sir John Watt. And drugs for inhibiting P4 cytochrome P450 are protease inhibitors, isoniazid, cimetidine, ketoconazole, erythromycin, grapefruit juice, sulfonamides. And uh, and that is it with the TB drugs.